Day zero is the moment before company formation, when a founder decides to take the plunge, follow their dream, and commit to pursuing their vision of change. On day zero, you'll hear founders tell their story. From the initial idea, through reactions by critics and skeptics, setbacks and successes, we'll cover it all. Behind every company is a founder with ambition, goals, dreams, and wisdom to be shared. Let's explore them together.
Well, thank you for joining us for an episode of Day Zero. I am joined here by Fank Westermann, who is a serial founder and who I've known for a long, long time, even in his first company. And so thank you, Frank, so much for being and joining with us here.
Lynn, thank you so much for inviting me.
Appreciate it.
Great to be here with you.
Well, let's first talk about the beginning of your journey, Frank, and just, tell us why you've become an entrepreneur. What has inspired you to, a multi-time entrepreneurial journey here? Tell us about the beginning of how you think about things.
I think, for me, it's probably a bit of a unique story and also a very personal story, because I think, what brought me to being an entrepreneur, and especially being an entrepreneur in healthcare and diabetes, is that I got diagnosed with type 1 diabetes around 2020. Oh my gosh, long time ago, 25 years ago now. So, and, where the first 10 years of my life with diabetes, I was not even thinking about, going into the diabetes direction. I was rather avoiding to meet people with diabetes because I had the impression that they were rather kind of bringing me down than kind of giving me more optimism to live with the disease. After a while, I realized that, I have probably that I live with diabetes is not just a curse, but also a blessing, because as a patient myself, I really better understand kind of what annoys you about using certain kind of devices or medications, how it is to talk to a doctor, what you appreciate, what you don't appreciate. And that was the reason why I started my first company, which was called mySugr, and which was basically an application, a digital tool that helps you to better understand your diabetes data. We used gamification elements to help people to be better motivated to take care about their diabetes. And it was a lot of fun. And that's how I got into the whole thing, basically.
Yeah. And I mean, honestly, that's how we started our journey, just knowing each other through mySugr. And, what's unique about mySugr is that you started that in Europe. And so tell us a little bit, just would love, you've now founded a company in Europe and one in US. You're in I'll call it San Diego, Southern California region now. With 9am. Just curious, because we haven't had a founder on Day Zero that's founded a company in Europe. Any differences you see? Any similarities in founding country in those founding countries?
Yeah, I mean, there are a lot of differences, of course. Some good, some bad. And when I think about us four mySugr founders now 10, 11 years ago, kind of, we just didn't know what to do. We got lucky. We got a few grants from the state of Austria, and non-dilutive, though no equity, just gave us money to, do something basically. I think it's hard to get that in the US. And also back then, and it's not that long ago, but it seems like forever. In like 10, 12, 13 years ago, basically, there was just one VC company in Austria, really. I mean, and one business angel, kind of, and we got lucky. We had, that business angel investing into us. Lynn, you also met him, Hansi Hansmann. So a great guy, my first mentor, amazing person. And, that was, and if I look at Vienna today, and of course, I have a lot of relations still to Vienna, the ecosystem just evolved a lot, and it got, I would say, but the US ecosystem, of course, also developed during that time. So it's even bigger and bigger and bigger as it is here. But a lot of things developed since then, for sure.
Yeah, absolutely. So Frank, you had a successful run with mySugr, actually exited to Roche with that company. And a lot of the same team members from mySugr started 9am with you. What was that like in terms of having kind of almost another built-in team that is also different than some of the journeys of our other founders. Would love to hear what were those conversations like?
That is, I think, one of the really great thing about also being an entrepreneur, that you can really choose, who to work with. And, my co-founders and a lot of, my 9am team members, they are my friends, and so what we did after, we decided to leave mySugr, we just basically as a team made a list, what do we want to do? And on one of the top positions was we want to continue to work together because we just enjoy, being around each other. We enjoy do stuff. We, a lot of things we think alike. There's also always healthy friction. So it was never, a question that we never thought about stopping to work together. So, and I totally do not regret, being around these guys and gals for the last few years.
Yeah. So let's talk about now your next venture, which is 9am and this team that came together from mySugr. What does 9am do? And, how did that differentiate from mySugr? What were some of those lessons learned from mySugr that helped inform 9am?
Yeah, I think in to a certain extent, probably 9am is a result of all the things we learned at mySugr, and also a bit of the result of, the pandemic, which we went through the last few years, or maybe still are. So many things changed. So when you look back at the time, when we were starting mySugr, there were no connected devices. It was, totally kind of, nobody would have ever thought that we would have virtual care doctors who prescribe medications online. And so that was a very, very different time. And as we progress, and now find, all these wonderful, opportunities we have, and quite frankly, also society who is much more receptive to doing everything virtually. It just was about time to, take these learnings, and basically where we had to stop at mySugr and build now layer on top of, just, looking at data, better interpreting data, really, layers the care level on top of that. And that's what we do at 9am.health. So at 9am.health, you really get everything that you need as a person who lives with diabetes, basically 24/7 support of a care team. You get your prescriptions. We deliver everything to your doorstep that you need, be it, for example, your medication or an A1C test kit. Or we even send kind of a home phlebotomist to your house if you rather have someone drawing your blood instead of kind of pricking your finger to do an A1C test, for example. So it's a very, very convenient, easy, and affordable way to treat your diabetes.
Yeah. Well, so how has it been building this company now, also in contrast to mySugr? You really built 9am during COVID, and you had a distributed team both here in the US and some team members in Europe. What are some of the lessons learned as a CEO and a founder around that?
That is a difficult question because, to be honest, Lynn, sometimes I really hate this virtual thing. I love to have people around me and work with people. So that is really hard. It's, I would have never imagined that you can basically raise 2 rounds of financing purely virtual. And that is clearly very, very different. But the good thing is, of course, it speeds up a lot of things. You can save so much time with not traveling, but doing things remotely. So that is for sure very, very different. Regarding, our collaboration, with or working together with our team in Vienna, that is something we have been used to. So because, the core of, our team members here in the US, there are old mySugr colleagues, and, we always worked with our colleagues in Vienna. So for us, nothing really changed, pre-COVID, post-COVID. So in that regard, we are probably a bit of a unique animal, but also kind of the people that we hired now. So for them, it's also, I think, they even enjoy to work with people in Vienna because also, it's it's an interesting aspect that we can add to what we are and who we are. And people, of course, like to visit the team in Vienna. So I was just in Vienna. 2 of our team members have been there working with the product team. So it's give everything a very interesting kind of note, I think.
Yeah. As you've built 9am, what are some of the lessons from building mySugr, things that you said, I definitely want to do that again, or, areas where you're like, I want to do it a bit differently this time? What would be some of those?
I think one thing that I clearly learned at mySugr, and Lynn, you have been partially part of, that part of the mySugr journey as well, of course, was that I had to realize that coming from Europe, things can be very challenging, especially when it comes, to having the financial resources that, allow you to grow fast. And we had that case, mySugr versus Livongo, where we at mySugr, we were raising, I think, 7 million, which was amazing for a healthcare company back in the days in Europe. But at the same time, Livongo was raising, I think, 350 million. And so you have to realize that, that is disproportional, and you can't really compete globally with the companies that can, outrace you so massively. And that's that's a learning I clearly take from, that journey with mySugr, that you need to be in the US to build faster, bigger businesses. Maybe it works in Asia as well. I don't know. It probably does. But in Europe, it's really, really hard. It's such a fragmented market. Access to capital is very different. And also valuations are very, very different in the US versus Europe. Incomes are also very different. It's also kind of a bit of a sad thing, I think, that, for us, kind of, Europe becomes a bit like an offshoring location where we have, access to really great talent for a lot lower price. These are just a few of the learnings we made.
Yeah. How do you build culture too? And what I'm interested in too is, you have such a tight senior team that you brought over from mySugr to 9am. And obviously, though, you've hired new team members. How do you kind of think about culture building when there's been a team that's worked together so long, but then now you have new elements coming in too?
Yeah. So first of all, I think, it's really, really tough to build culture remotely with Zoom. I think all these companies who are purely remotely, it must be horrible. I always prefer to have people somewhere around here, not that everybody needs to be in the office every day, but I think to really build culture, to get to know each other, you need to see each other, work with each other, in person. It is so hard to do it over Zoom. So that's one thing. The other thing is, I think we have, and it's not only kind of the senior team, that, came over from mySugr, but also just a lot of people we worked with, joined us. And of course, there is that bond. But on the other hand, I think we have a very, very strong mission, and a lot of people that, join us, 9am.health, they join us on that mission. And then it's just one mission that drives everyone to work on the same goal. And it doesn't really matter if you work together at mySugr before or not.
Yeah, no, that makes a lot of sense. The other thing that you're really targeting with 9am, as you've said, is a more direct to consumer approach while having the depth of like an end-to-end solution around diabetes care. How have you thought about, as healthcare becomes more consumer, what are the opportunity sets you see or the challenges? How does it affect your team build, and how you've thought about that as an example?
Yeah, I think, that great experience must be consumer style experiences. And, telling something directly to a person and asking for their money directly and not through like a healthcare insurer who reimburses a service is something very different, because you get direct feedback. You are forced to build a great service, a great experience, with something that is in nature not really something you like to do. So you're forced to do your best very differently than otherwise. And we rather take that route as something that shapes our product, shapes how we think about providing better care, and sets up later on to maybe go to employers or other more traditional players in the healthcare space. So, but we really see the consumer as the most important, the consumer, the patient, and at the most important factor. And I think that direct relationship just helps you to build a better experience.
What are some examples, Frank, of where you maybe heard from a consumer, or just because of your knowledge of the diabetes journey, like that it influenced, product or UI, UX in a way that you were saying that closeness with the consumer is so important?
There are so many examples. And I think, what really stands out about what we do is that we really wrap the whole diabetes care journey. And I hate this journey term, that we use so often, because it always sounds like a vacation trip. But the diabetes care journey is like, it is so cumbersome, like always you need to go to a doctor, you need to pick up your medications, you need to not forget about so many things, and providing everything in one cohesive experience, having someone who really, talks your language, understands what you think. A lot of our diabetes care specialists, they live with diabetes themselves, or they have at least, someone there in the family that lives with diabetes, so really understand, how you feel as a patient. And I think that is something that is super unique about what we do. That is something that our users absolutely appreciate, and that's why they love us.
Yeah, well, that's the new tagline, Frank, is that working with 9 a.m. It's not work, you're on a vacation. I think that's what we should. Our patients feel like they're on vacation, which does raise the question: how did you come up with 9 a.m. the name?
Yeah, it's we are a virtual diabetes clinic, but we also more broadly, we also, for example, treat people if they have like hypertension, hyperlipidemia. So we are a chronic care platform at the end of the day. And if you live with a chronic disease, you have it your life long, but you of course have good days and bad days. And especially diabetes is a disease that where individual decision can determine so much of if you have a good day or a bad day. And the good thing about, that is that you always, even if you struggled one day and you had a bad day, you have a next day, and in our opinion, the tough day starts somewhere around 9 a.m. when, you dropped the kids at school, you had your breakfast, and you're ready for the real day, and and you have always a chance, to do better than before. And that's why we named the company 9am Health.
I love it. So Frank, maybe just reflecting, again, we've talked so much about mySugr, 9am. What are just some pieces of advice you have for other entrepreneurs that are undergirding their journey or, their vacation, however we want to say? What's some advice you have for them?
I think I always give a very simple advice. I'm not a smart person, so as simple as it can get. These are things I understand. Yeah, but I think you follow your gut. You need to be really passionate about what you do, and then really follow your gut. I think your gut a lot of times really tells you if a decision is right or wrong, and if it doesn't feel right, don't do it. And that's, I think, the most important thing. I had to learn it kind of the hard way. And it's still sometimes really hard to follow your gut, because your brain tells you it makes so much sense to do that. Frank, do it. But your gut tells you, it doesn't feel right. And then really the gut is right. The gut is always right. That's my first advice.
No, absolutely. Absolutely. Well, thank you, Frank, so much. Appreciate this walk through what's inspired you and being a multi-time founder in multiple countries, and what you're doing today, and just like how the patient centers around everything you do. And and ultimately, to your point, follow your gut to like what makes impact for patients. I think if I think of you as a founder, absolutely, that's something I think about all the time when I think about 9am and your team. So thank you again for joining us here at Day Zero, and really appreciate your time.
Thank you so much, Lynn, for inviting me. Thank you.
Absolutely.